Hello, my name is Diana Schack-Toft and I'm Research Manager at the Research Center for Health and Applied Technology. We conduct research about digital health literacy, and in this short video I would like to share with you one of the biggest challenges the healthcare system is facing. Our healthcare system is under pressure. We live longer with multiple diseases, and at the same time there is a shortage of healthcare workforce. This affects the quality, accessibility and sustainability of our healthcare system. The use of digital technologies can be a part of the solution, but only if we are able to use them. And that calls for digital health literacy competences, both among citizens, patients, healthcare professionals, but also among the organizations that are implementing digital solutions. Digital health literacy is more than being digitally skilled. It's about being able to search, interpret and understand digital information about one's health and then being able to act upon it. Recently, we brought together researchers, practitioners, policymakers and students from across the world for the first European Digital Health Literacy Conference. The aim of the conference was to gather experts in the area to exchange knowledge, challenges, and to discuss possibilities to strengthen the development of a more inclusive and sustainable healthcare system. The conference aimed to discuss 4 different perspectives, and you will now see them in the video. The citizen perspective, the professional perspective, the organizational perspective and the research perspective. Only by including all these perspectives and moving in the same direction, we can build a healthcare system that are both sustainable and inclusive, and where everyone is supported to navigate this digital transformation.
Ja, jeg kommer jo tit hos min læge, fordi jeg har diverse skavanker og har nu også fået konstateret kol. Jeg har fået udleveret en iPad, hvor der er nogle spørgsmål på. Så skal jeg tage mit blodtryk og iltmætning, og jeg skal indrapportere, hvad jeg vejer en gang om ugen, så de kan se, at jeg ikke taber mig på grund af sygdommen. Og så er der jo så en masse spørgsmål om, hvordan jeg har det nu, og om det er blevet værre, og dem skal jeg bare svare på.
We think it's very important to make sure that practice and research has a focus on patients, users, citizens in relation to make sure that they are able to use the digital solutions that the organizations offer them.
I think that the research that we're doing, which is so valuable, we have to look at ways that we can also implement in practice the results of the research. We have to share the research, we have to create forums with practitioners and policymakers so that the results will be fed into action that can be taken for the public good.
It's really the organizational perspective, so it's not just about how skilled are you, it's equally as important to look at the question how easy do the organizations make it for you to find information and use services.
I think it's really important to see how research and practice can go hand in hand, because to make sure that research knowledge gets out and transform practice, we need to know what the challenges is in practice and learn from that and develop the research in relation to that. And it's also important that we inform practice about the research results so it can have a life out in practice.
Healthcare professionals, those who are in direct contact with patients, of course they have a role and they have great opportunities as well to make it easier for them to find the information, to make sure that they understand the information that they get and that they are able to navigate in this world with lots of choices, lots of information, and find the relevant services, find the relevant information.
Jamen, jeg hedder Annette Stikker, og jeg er ansat i sygeplejen i Aalborg Kommune, og jeg er ansat som telesygeplejerske. Mit arbejde det består i at inkludere kol- og hjertesvigtsborgere i forhold til telemedicinsk løsning, og oplære dem i det, og stå for at aflæse de målinger, de sender ind. Borgerne de kan opleve en tryghed i, at de sidder derhjemme og kan lave de her målinger, sende dem ind i ro og fred. De behøver ikke at skal ud af huset. De kan gøre det på det tidspunkt på dagen, hvor det passer dem.
Focusing on practice-relevant research is really important to make sure that we can unlock the potential of this digital solution in our healthcare system. And I think a key to that is to focus on digital health literacy.
Researchers nowadays have identified that it's not just about online health information comprehension. There's also privacy and security competences, also monitoring your health with devices, and it's impossible to mention digital health literacy without mentioning AI today. So as technologies evolve, there's more and more levels to digital health literacy than yesterday or 3 years ago.
One of the things you realize when you research artificial intelligence or AI systems in healthcare, enough as I've done, is that it's a technology that takes up a lot of time and effort, and it's one that tries at least to change the core of the work of healthcare professionals. But it's also, like anything else in healthcare work, it's a tool. It's one that comes in at times when it's needed, and it's one that healthcare professionals will also do their best to ignore or reject when they don't think it's needed. And as such, it has quite a complex role within healthcare settings.
We are starting to see that digital, in some specific cases, actually improves quality of care. It can improve, as we're discussing, timeliness of care, making sure that you get your appointment on time. What I think is really important, and this goes back to our point on evaluation, is when we are able to demonstrate that digital innovation can actually improve timeliness of care, can actually improve clinical outcomes. These are really strong arguments to convince, and I don't say convince in a forcing way, but to show, to demonstrate to the public that actually, even if they don't want or their preference is not digital, there's actually a huge benefit there.
It requires healthcare professionals to talk to patients about the tools that they're using. And again, AI is probably a great example of that, because it can be really difficult to explain what the technology is and what it does and why we use it. But it also requires you as a healthcare professional, both AI and many other technologies, to actually be able to critically appraise the outputs that we get from these technologies.
Hvis borgerne ikke er så digitale, så går vi rigtig meget ud af at gøre dem trygge i det. Vi bruger meget tid på at oplære dem. Vi kan komme ud til flere besøg og oplære dem.
Det der skema, jeg skal indrapportere hver uge på iPad'en, det synes jeg er super nemt at bruge. Det er meget, meget enkelt.
I think we are looking at opportunities now that practitioners can be involved in the research, not just for research purposes, but also to have them help them understand the needs of their patients even better when they, up until now, may not have been given the opportunity to do so. So our tools have to be translated to tools that can be used in order to be able to understand how patients and people who are receiving healthcare, or those who are not, but are still within the responsibility of the healthcare system, are accessing tools to promote their health.
Betydningen det har for mig, at jeg skal melde det ind digitalt, det er, at jeg ved, der sidder en i den anden ende og holder øje med mit helbred. Og det synes jeg er en god ting. Det er jeg faktisk tryg ved, at der er.
I'm actually quite hopeful. A lot of the barriers that we thought would be there, age particularly, have not been completely proven. And I think it's actually quite a humbling exercise to deconstruct this prejudice that age is a barrier. Because someone with 80, 85, even 75 years old has been through so many different innovations on their lifetime, and they have adapted very well. So I think we must keep in mind that people are adaptable and are able to interact and to engage with technology. And we have seen, age was not the barrier for people to engage with social media because it was easy to use and they perceived a benefit there. So it's as important to build literacy and build trust as it is to make technology accessible. So maybe we can meet in the middle, and that would be a more efficient way of addressing it.
Like any other technology we introduce into healthcare practice, is difficult and challenging to implement, and implementing it well requires us to listen to the healthcare professionals who use it, to the patients who will be subject to its decisions, and hopefully learn from it rather than just implementing it and hoping that we're then done.
Jeg synes, det er vigtigt at sige, at digitale løsninger, det er simpelthen fremtiden. fordi at vi fremover kommer til at mangle varme hænder i sundhedsvæsenet, og at der bliver flere og flere ældre, der får behov for sygepleje. Og det her, det er en måde, vi skal tænke ind på, hvordan kan vi hjælpe på en lidt anderledes måde, hvor vi ikke behøver at komme ud fysisk i hjemmet, men stadigvæk kan yde den hjælp, der skal til på afstand.
I really hope that we can join forces because there are so many exciting initiatives going on in the EU, and it's really important that we make sure that it doesn't stay local, but we try to upscale it and try it out on a national but also an international level.
As someone who primarily researches AI, I did not realize, I think, how much we can learn about how to help healthcare professionals understand and use AI responsibly and in a way that's literate from existing digital health literacy tools and studies and projects that we already know of. We often talk about AI as a sort of a new industrial revolution. It will change the entire healthcare sector. But really, the ability to use the tools to assess and appraise their outputs, that goes for any sort of digital health technology and digital health literacy. And I think I've learned that we can learn a lot from what we already know today for future technologies.
Man skal melde sig til det, hvis man får tilbuddet, fordi det er simpelthen, det er simpelthen så nemt. Også hvis man ikke er i nøren til det digitale, så bare kom i gang.
I hope this video will inspire you, your practice and your professional journey. Because you, healthcare professional and researcher, will play a crucial role in shaping the future digital healthcare system that will evolve and succeed. So thank you very much for watching.